And we'd like to say good afternoon, ladies and gentlemen. Welcome down to SHF Facebook channel. And my name is Samson Z, your host for today. It's about 2 p.m. right now. And of course, for those of you at home at work, how are you doing? I hope you guys are having a great, wonderful life, eating healthily, and also, exercising as much as you can. Now, today, ladies and gentlemen, we have a very, very special guest joining us, our cardiologist. And today's theme as well is Ask Anything About Heart Health Live. And of course, ladies and gentlemen, here are some facts before we begin. Now, cardiovascular disease, or CVD, is a leading cause of death in Singapore and globally. Now, in 2020, it accounted for 31.7% of death in Singapore. Now, it is hence important to understand its risk and learn how to care for our hearts by adopting simple lifestyle habits, as CVD can affect anyone at age. Now, today, cardiologist Dr. Mak Koon Hou will answer any questions you have about heart health. And once again, if you have any questions for Dr. Mak, please leave your comments below. So can we see Dr. Mak live with us today? Dr. Mak, how are you?
I'm fine, thank you, Samson. How are you today?
Fantastic. Are you at home right now or are you outside in the office?
No, at home. Yes, it's Sunday, so yeah, we should be at home. Anyway, we should be at home because of COVID.
Fantastic. Okay, so ladies and gentlemen, before we get started, now, Dr. Mak, could you tell us what does CVD stands for and who does it affect and what are the risk factors associated with CVD?
You know, the other day when someone told me he was driving down this CBD and he saw all the buildings turn red just a few days ago, and they were scared because they thought that, oh, wow, is that DORSCON red for COVID-19? No, no, no. I told you, no, this is not the case. This is the case whereby, the Singapore Heart Foundation is celebrating Go Red for Your Heart, which is a way of telling people that, you should spot red flags in your body or in yourself to find out what are the risks for what the Samson has told you, CVD or cardiovascular disease. Cardiovascular are actually a composite of two words. Cardio means heart and vascular means blood vessels. So cardiovascular disease means the diseases affecting the heart and the blood vessels. So they more or less share the same sort of what Samson mentioned or alluded to, risk factors. Risk factors are, that means some factors that make you at a higher likelihood of acquiring cardiovascular disease. You know, the heart disease is a variety of many heart diseases, includes diseases of the valves, the muscle, and so on. So cardiovascular disease is a bigger term that encompasses many of these conditions. And the commonest of those is what we call coronary heart disease, in which the blood vessels of the heart is affected. So the red flags that we talk about for Go Red for Heart in this COVID-19 season, despite the overcrowding, the chronic and issues that we are facing, because priority is given to those diseases. So I hope that this seminar will remind us about what are some of these red flags that we face, and then we should continue to modify them despite the focus on another pandemic or endemic that we are facing now. So basically, there are two main types of risk factors we talk about: the risk factors that we can change and the risk factors that we cannot change, or what we call non-modifiable risk factors. You know, we say age, I mean, something that we certainly cannot change. As you grow, and every second, every minute, we grow older. And then for the gender-wise, we also, we can change the sex. You can go for a sex change, you can take hormones, but change the sex. We are talking about genetic sex. And genetic sex, men being more at a higher likelihood of acquiring heart disease than women, until they are maybe 5 years after menopause, then the risk of women increases substantially to that of men. Then for ethnicity, we found that in Singapore, there are three major ethnic groups that we have. The South Asians has the highest risk compared with the Malays, which is at the second highest, and the Chinese, which is the lowest. The ratio is about 3:2:1. That means South Asians are 3 times more likely than Chinese to suffer from a heart attack. Malays are 2 times more likely than Chinese to suffer from a heart attack. So that's what roughly it means. So they say you can choose your friends, but you can't choose your family. So genetic markers and what your family history is, these are the factors that are what we call non-modifiables. You cannot change those factors. But there are many other factors which you are concerned about, which you can modify and take an active step to change them. And those are the factors that we want to stress upon, that you can do something about it. For example, high blood pressure, high cholesterol level, diabetes, smoking, being inactive or lack of physical activity. You know, Samson here is a great tennis player, I was told. So you can learn from him too. Obesity and also stress, something that we all need to manage. So these are some of the modifiable risk factors that we can manage, and we are probably will go through them subsequently.
Thank you very much for the description. Well, for those who just joined us, once again, a very good afternoon. Together with us is Dr. Mak Koon Hou, our cardiologist, and today's program is Ask Anything About Heart Health. Now, I have some questions for you, Dr. Mak. This was taken or rather submitted from the registration form earlier. So a question here comes like this. This is from Anne. She's about 62 years of age. She's asking if this is acceptable for her blood pressure. It now reads 140/80. Now, it might change to 130 to 78 after a while. But before the age of 60, her blood pressure was usually 120/80. Now, she says she leads a fairly active life and more than 150 minutes of exercise a week and eat healthily. Is there any concern for her?
Yes, thank you, Samson, and I hope that Anne, you are with us somewhere in the web space. Thank you very much for your question. You know, blood pressure is not just a number that we measure. Blood pressure is actually the measurement of the pump that we have in the body, which pumps blood from the head to the toes, literally. So this is something which is needed for us to survive and to live, because this is something that we bring the blood to the bodies to bring nutrients and then oxygen and remove stuff like carbon dioxide and various waste products. Now, we know that as we grow older, blood pressure tends to rise. Nonetheless, the normal blood pressure for everyone is to be taken at about 120/80 millimeters mercury. The top number is known as systolic, is when the force of the heart pumping, and the second number is known as the diastolic, in which it at least talk about roughly the relaxation of the blood vessels. So both readings are important. Several what we call population or epidemiological studies have shown that the higher the blood pressure is, the more likely a person succumbs to a cardiovascular disease. So this is regardless of the age group. But we do understand that as we grow older, sometimes the blood pressure needs to be higher. So to answer your question, blood pressure fluctuates quite rapidly sometimes. For example, you know, if your bladder is full or you are facing an exams like the PSLE mathematics questions that you see, your blood pressure will rise up when you're under stress. But when the stress event is over, sometimes it may take longer, sometimes it may take shorter for the blood pressure to come down to normal. So the general recommendation is that the person who's measuring the blood pressure should be in so-called a relaxed stage in a quiet room for 30 minutes before you measure your blood pressure. That's a long time. So most of us do not have the luxury of that 30 minutes. So maybe at least 5-10 minutes of rest would suffice. I mean, what is recommended and what actually we practice can be quite different. So sometimes when you go to a clinic, your blood pressure it rises, or when you feel the pump squeezing your arm and it's painful and your blood pressure can rise too. But maybe the second reading, the third reading after 5-10 minutes, you take and you're more accustomed to the squeezing, then maybe the blood pressure will come down slowly. So you will have to take a couple of readings, sometimes 2 to 3, 4 readings before you know what your actual resting blood pressure is. So if your blood pressure, sometimes when you take is 140/80, that is by definition high. But as you mentioned, it rests for after a while and went down to 130/78. That is actually borderline high or high normal, as some people would put it. So in that case, you still have continue with regards to monitoring your blood pressure, understanding some of the influence that could have caused your blood pressure to go up. I remember one of the older doctors that I treated. She says that after she goes to the hawker center and she had the fishball soup noodle, and then when she came back and she measured her blood pressure and rose to 180 millimeters mercury, not realizing that some of this food has got high salt content. And after you eat a food that has got high salt content, sometimes the blood pressure just rises up. And after maybe you drink water, wash it out, and the blood pressure will come down. So you recognize some of this food could have influenced your blood pressure when we're not even talking about stress, you're not talking even about physical activities. So those are the things that could have influenced your blood pressure. So continue to eat healthily and exercise well. I think you're doing very well. And we continue to monitor your blood pressure together with your doctor, and they will manage it accordingly. I hope I answered your question, Anne.
Well, thank you, doctor, for that detailed explanation. That's right. So in short, ladies and gentlemen, in summary, whenever we go and see the dentist, whenever we go and see the doctor, whenever we go and see the principal in the office, when we were very young at that time, our heart rate will go up because we are afraid, we're stressed. Very good point there to take note. Yeah. So remember, guys, it might go up, but yeah, test at home a couple of times first, and then you go and see the doctor later. So the reading will be, we'll call it the average reading you get. Okay, next question from Arifa. Now, why do people with a lower BMI, let's say from 18.5 kilogram per meter square, still get a heart attack? Doc?
Yes, thank you, Samson. Yeah, I mean, Samson was just sharing about lives, and he's got a very different life from most of us in the lifestyle whereby there is a lot of other activities as a social person. There may be people who do a lot of smoking, drinking, and other sorts of activities. Earlier, we mentioned about risk factors. Risk factors are those that are modifiable, that means those that we can change, and non-modifiable, those that we cannot change. So being obese is only one of the risk factors. There are several other risk factors, like we mentioned, age, whether you're from certain ethnic group, certain gender, and whether the person smokes, whether the person has high blood pressure, and the family, and so on. So the other risk factors come into play, and it's not just one single risk factor. So the easiest to understand sometimes is that, smoking. There's always, I inform my patient, we all are quite convinced that smoking causes lung cancer, but not all smokers get lung cancer, and not all non-smokers do not get lung cancer. So smoking is an increased risk, increases the risk of a person getting lung cancer, but doesn't mean that when you smoke, you will get lung cancer. But we do know that when you smoke, and the more cigarettes you smoke a day, the higher the chance you get lung cancer. So therefore, the advice is to quit smoking. So similarly for heart disease, the more cigarettes you smoke, the longer you smoke, the higher the risk that you get heart attacks and heart diseases. But doesn't mean that you will not get heart disease when you're not a smoker.
I see. So there are various factors involved as well. So do check whether is it heredity, your age as well, and your ethnicity as well matters. Modifiable and unmodifiable scenarios.
Thank you very much, Samson, for your summary.
Now, one more question from Sri. Now, do varicose veins affect the heart increase the risk of heart attack? Some people start to see varicose veins coming up from their legs, from their calves at a certain age. Can you explain, doctor?
Thank you, Samson. And Sri, I suppose you are an active soccer player because varicose veins basically is a problem with the veins, usually affecting the legs, but it can also affect the arms too, but most commonly affecting the legs, whereby the valves, there are some valves in the leg veins which helps to bring blood back to the heart. When we are standing, and the blood needs to come back from the leg back upwards to the heart. So when the heart pumps, if this valve is to stop the blood from going back. When you pump up, so it's something to stop it from coming back. So when the valves are spoiled, so these valves are spoiled, so the blood stays back and the legs become swollen, and the veins become big because they just accumulate blood in the veins itself. So it's quite a different disorder compared with heart diseases, which is basically a disease of the arteries. That means the blood vessels that bring blood to the body or to the heart and to the various parts of the tissue. The veins are blood vessels that brings blood back to the heart. One brings blood away from the heart and one brings blood back to the heart. So there are different disorders, and they are not directly related in terms of varicose veins and the heart disease. So when you're a soccer player, there's increased trauma, you kick the ball and someone kick your leg and so on. So sometimes the valves get damaged. And when the valves get damaged, you're more likely to get these varicose veins.
I see. Okay. Now, some people also say that, what about salt, water retention? Too much salt, you might get your legs to be expanded, or, is that true?
Yes, if there's too much fluid for whatever variety of reasons, the legs sometimes get swollen, and particularly in older person, especially in females, especially those women who have done their national service by bearing a lot of children. The fetus or the baby in the womb press onto the veins in the pelvis, and sometimes this pressure, some of the back pressure of the baby pressing the veins on the pelvis cause these things to occur, like the swelling of the legs.
Okay, so now comes a general question for those of you who just joined us as well. This is going to be a general question. Once again, a recap. How do we know if we have CVD? What are the signs and symptoms?
Cardiovascular disease will just focus on the heart because it involves both the heart, the brain itself. They can cause strokes, kidneys, and elsewhere, and legs too. So there are many areas depending on the region that the blood vessel is diseased. So the commonest of this and the most that we heard of are the brain and the heart. So for the heart part, it can be silent. We know that about 50% of people with heart attack do not have symptoms before the first heart attack. So therein lies the danger of coronary heart disease, because heart attack can kill sometimes. So the commonest symptoms are chest discomfort, chest pain, shortness of breath, palpitation, giddiness. So these are some of the common symptoms. But in women and in older people and in people with diabetes, some of these symptoms become more vague. I'm tired. I'm just not feeling myself. I just have this vague discomfort. I'm not sure what it is. So it may be just like that for older folks, for women, for people with diabetes. For stroke itself, you can have silent strokes too. Nowadays, there are a lot of brain imaging that we do, and there are many so-called silent area, in which that means there's a stroke and affecting the area that doesn't affect any function that we are aware of. So the common symptoms of stroke are like numbness and weakness, and difficulties in talking, seeing double vision, and difficulties in swallowing. So these are the more common symptoms of stroke. So for the common parts are the head and the heart itself. For the legs, less common. When you walk, you find that there's pain in the thigh or in the calf. That's when the blood vessels in those areas are diseased.
So we hope you guys are able to remember those signs and symptoms. So if you're not very sure, you can always visit a doctor to find out more. Don't take chances, yeah?
Or you can visit the Heart Foundation website.
There you go. And of course, our website, our Facebook, our video channel as well has so much resources for you to watch. We have in English and also in Huawen, in Mandarin as well, okay? So for those of you who don't understand English, not to worry. We have the Mandarin program for your understanding. Okay, let's move along. We have a question from Tong Lak. Now, does consuming caffeine or rather a cup of coffee daily put us in a higher risk of CVD? I'm sure a lot of people go to office and they drink coffee every day. So tell us a bit more. Is this a myth or is this a fact?
Diet is a very difficult subject to study because there's so many and so much variabilities in terms of the study. Some studies shows, yes, they may be increasing other factors. Some other studies say no. So by and large, the common advice is in moderation. 1 to 2 cups of coffee a day should be okay. But if you are having palpitations, or sometimes the caffeine can cause gastritis because of the acidity of the coffee itself, do bear in mind those issues. And then because some of these symptoms, they can cause extra beats and they can cause problems to you as well. But excessive consumption of coffee probably will be detrimental to your health in general.
Okay, so in general, as you mentioned, in moderation, whatever that you're eating, even if it's consuming good food, also everything also must be in moderation. Don't over eat too good food, and also don't overeat things that are bad for your health. All right, now coming from Dave Tan. Now, this is a very serious question. I think it's quite serious as well. Listen up, everybody. Listen, Dr. Mak. Sometimes, though not frequent, I feel a momentary sharp pain in my heart. It usually happens suddenly and lasts for 1 to 2 seconds. Now, I've experienced this for a couple of years, about once a month. Is this a concern?
Yes, I mean, as with all medical complaints, they should be addressed to a doctor. So the best, I mean, have you seen your own physician or GP or someone regarding this issue of chest pain? In general, so people with heart disease, when they have pain, is usually due to a lack of blood supply, supplying to the heart muscle, and that gives rise to pain. So the easiest way to experience some of this pain, you just occlude your hand, block the blood vessel to your hand, maybe for, you see, when you block it for a few seconds, you won't get pain. But when you block it for maybe a long time, 5 minutes, 10 minutes, 20 minutes, your hand, when you release, you get some pain and pins and needles. And so you have some symptoms there, and then it will give you an idea of how the pain due to lack of blood supply comes about. It doesn't come immediately. It doesn't go away immediately because the pain arises because when there's lack of blood supply, there are certain substances that are being produced, and these substances causes pain. And these substances needs to be washed away or cleaned out before the pain goes away. So the pain usually comes on after some form of physical activity, mental stress, or some other activities that cause the pain. And the pain usually lasts for a couple of minutes rather than a few seconds. And then that's why it doesn't go away immediately. So this is how we analyze symptoms. There are certain other characteristics of the pain, the symptoms, which your doctor will need to evaluate whether the pain is likely or less likely to be from the heart. But usually that is how a pain comes about from lack of blood supply and how the pain goes away from the lack of blood supply.
I see. So don't take chances. I would always probably suggest or recommend early detection is always better, isn't it? Yeah.
Yes, of course.
So take note, like guys, if you're above 40 or around 40, go ahead, do regular checkups as much as you can because you never know what's ahead of you. The docs know better. Okay, Dr. Mak, now how is CVD diagnosed in most of these health establishments?
Yes, we just focus mainly on the heart itself, the cardiovascular disease. So basically, the most important thing is symptoms, whether the person have any symptoms or not. But having said that, a lot of patients do not have symptoms. So there are several tests that can be used to ascertain whether there is a disease of the heart. So in general, there are the stress testing, which do whether there's sufficient blood flow going to the heart when during exercise. But the basic ECG testing is not very accurate and particularly inaccurate for women. So we can create a false positive. False positive, that means the person does not have the disease, but the report says that you have the disease, or false negative, that means the that you do not have you have the disease, but the stress test or the test doesn't show that you do not have the disease. So these are the considerations that be taken into account when you go into some of this testing, and the doctors who undertake this testing will advise you accordingly. The other tests, like your blood test in terms of the risk factors like sugar, cholesterol level, and your blood pressure, all those can be done easily by your family doctors. The routine, just basic resting ECG or electrocardiogram doesn't usually tell much about heart disease unless there's a previous heart attack or something which is more drastic than that. Some people will use what we call calcium scoring. Calcium scoring is a form of X-ray that is taken. Basically, it's a form of CT scanning, but it doesn't involve injection of contrast. That means injecting stuff into your body. It takes about, maybe depending on the machine you use, is maybe close to about 20 chest X-rays, the amount of radiation that you receive, 5 to 20 depending on the type. So the calcium scoring basically gives you a number of the amount of calcium in the heart vessels. So the higher amount of calcium, the more the cholesterol plaque or the atheroma are there in the blood vessel. So it's a surrogate marker for the amount of atherosclerotic plaque in the arteries. And they will help the doctor to ascertain how aggressive we should treat the other risk factors you have. Some people will even inject in contrast and to see the blood vessels, whether there's any narrowing or not in those vessels. And of course, there are some other tests which are more sophisticated stress tests, which they do and give a more accurate reflection of the flow, whether there's a sufficient blood supply to the heart muscle itself. So there are a variety of the tests that can be done, which can be used to assess for narrowings of the blood vessels.
Amazing. So in general, we have ECG, we have CT, we have MRI, and a few other tests that you mentioned as well. So folks, there's many tests available. Just do not be shy or don't, hold yourself back. It's best to always check early. Yeah, don't.
Yeah, your doctor will recommend the tests that you need, and sometimes more tests sometimes may create other problems. So you have to be very clear of what you want to do.
That's absolutely true. Now, we have another question coming from Margaret Koo. Now, she says, is it normal to experience arrhythmia detected on her ECG for seniors aged 65 and above? Does this mean I have atrial fibrillation?
Thank you, Margaret, for your question. You're using a very sophisticated term called arrhythmia. Arrhythmia basically means the abnormal heart rhythm. So when you say abnormal heart rhythm, by definition, it is not normal because the abnormal came before the heart rhythm. So arrhythmia means abnormal heart rhythm. Abnormal heart rhythm can be fast, can be slow. So though arrhythmia just basically means that you have an abnormal heart rhythm. So the next question is, what is the cause of the abnormal heart rhythm? So sometimes there may be what we call benign abnormal heart rhythm, which is sometimes just irritating, but it is not serious. And there are certain things that used to suppress or to reduce the occurrence of these abnormal heart rhythms. On the other hand, there are other types of abnormal heart rhythms which are more serious. And you have mentioned one of them, known as atrial fibrillation. Atrial fibrillation means that there's disorganized rhythm in the upper chambers of the heart. Maybe just to revise slightly, there's an upper chamber and there's a lower chamber. The lower chamber is the main pump that pumps blood to the whole body. The upper chamber is what we call a feeder pump, which pumps blood to the main pump so that it fills the main pump up to pump blood to the whole body. So it contributes to about maybe a third or a quarter of the pump function of the main pump. So atrial fibrillation, the heart is pumping in terms of is in synchrony. So in atrial fibrillation, the heart is not pumping synchronously. So instead of doing one action like that, it's like some people describe it as a bag of worms. They say it's like a bag of worms that's inside. So it is just not pumping. So the blood doesn't really pump and just flow through. So there's atrial fibrillation. The rate of this pumping is about maybe 300 beats per minute, and it comes from all over the place instead of being synchronous like that. So atrial fibrillation is a separate condition where the heart beats irregular because it's so rapid, and it has two major complications related to it. One is because it's not beating regularly, so the blood doesn't flow smoothly, so it just go round and round, and clots can form. And when clots form, and sometimes the clots dislodge and it goes to the brain, you get a stroke. So atrial fibrillation can lead to strokes. And atrial fibrillation, because the heart is beating irregularly, the main pump, so sometimes the heart become weakened because it doesn't get a synchronized, like, the heart say, oh, sometimes fast, sometimes slow. So after a while, they get tired and it become weaker. The muscle can become weaker. So these are the two problems related to atrial fibrillation. So whether you have atrial fibrillation or not is a separate issue in a sense. From arrhythmia, arrhythmia means abnormal heart rhythm. Atrial fibrillation is one type of serious abnormal heart rhythm, which is fast. There are other slow abnormal heart rhythms. So I hope I answer your question.
So many variations and subcategories as well, yeah?
So just fast, slow, normal, abnormal, then fast, slow.
All right. Okay, one more question from Ms. Low. This is quite scientific as well in terms of the explanation. Now, will mild aortic valve sclerosis become stenosis?
Thank you again for all this. Well, your readers are, or your audience is very technical. Okay, the heart has got four major valves, two on the left and two on the right. So two. So the aortic valve is on the left side, is the main valve that pumps blood out of the heart into the main blood vessel. So this is known as the aortic valve. The aortic valve is subjected to wear and tear. Just unlike the kitchen, when you open your tap, after a while, the leaflets or the valve get thickened, and then you need to change a new one and ask the plumber in and change a new one. So aortic valve basically controls the blood going back out of the heart. And so sclerosis means that there's thickening of the leaflets of the valve. So like, for example, your kitchen, the tap, when you open, when it's old, you can see that it's no longer the thin rubber, but become very hardened and so on. So that's the beginning of the aortic sclerosis. That means the valve leaflets become thicker. Stenosis means that there's narrow. It's a Latin word, means there's narrowing of the valve. So the valve becomes narrow because it's thickened, so it doesn't move very well anymore. So therefore it's narrow. Instead of moving very easily, it becomes narrow. So that's called aortic stenosis. All of us have a risk of getting aortic stenosis as we get older, just like the water tap that we have in our kitchen or in the bathroom. The aortic sclerosis is just the beginning of the step of getting stenosis. But when not all aortic sclerosis will lead to aortic stenosis. As we get older, most of us will get some form of aortic sclerosis because of age, because of wear and tear. There will be some form of thickening of the valve. Stenosis is when the valve becomes thick and it becomes unable to open very well. And that's because this becomes stenosis, which comes from the Latin word narrow. So that's stenosis. So will mild aortic valve sclerosis become stenosis? Yes, even normal valves can also become stenosis, just that it is a matter of degree and progression. So the question is, how do we prevent the stenosis from happening? That's what your Ms. Low wanted to know. So it's the same risk factors that we talk about, wear and tear. When the pressure is high, treat the high blood pressure. Stress, eat well, eat healthily, and exercise well. The same message goes through for all these conditions.
Well, there you go. I hope, Ms. Low, you have your answers. Now, those questions earlier on were basically all about diagnosis of your CVD. Now, let's come into the treatment category. Now, what are the treatment options available for those diagnosed with CVD?
Once you're diagnosed with CVD, there's of course medical treatment, and there's some form of interventional treatment. So majority of the medical treatments are aimed at reducing heart attack, reducing in the progression of the narrowing, and of course preventing death. So there are several medicines that have been shown to be able to do that. For example, the simple aspirin has been shown to be moderately effective in preventing heart attack, death, and stroke. So this is something that once diagnosed, some form of medicine that is used to prevent the platelets from clumping one another, which is what aspirin does. So there are other medicines that can be used. Importantly, the cholesterol lowering medicine has also been shown quite conclusively, despite what you read from the internet about all sorts of messages that you receive. But for those with established heart disease, I cannot overemphasize that this medicine will prevent the person from getting heart attack and prevent them from dying from heart attack. I think a couple of years ago, I think in Australia, ABC, they had this program, and then which cast some doubt on the use of the medicine. And after that, people stopped using the medicine, and the heart attack rate actually rose, and ABC has to recall that program altogether. So for those with established heart disease, the evidence is quite sure, quite certain. For those that are primary prevention, okay, maybe less certain, but there's benefit, but there's also risk factors. So, but for those with established, because your question was those with established CVD, yes, definitely they will lower the risk of dying from heart diseases. So the other medicines that can be used, then there are also in other interventions, they are used to usually treat people with acute heart attacks and those with a lot of symptoms, and those with shown to have abnormal stress tests like angioplasty, stenting, bypass surgery. And of course, in the very, very late stages, there's the heart transplant, the artificial heart devices that can help to those patients as well.
There you go, a very detailed explanation as well. And next question is, can heart inflammation be cured?
This is, I presume, you talk about the heart muscle inflammation from the story about the COVID-19 vaccination in the young people that are having heart inflammation. I suppose that's where the question is, because there are two types of inflammation that we talk about. The commoner heart inflammation that we talk about is the inflammation of the blood vessel. It is believed that the low-grade inflammation of the blood vessel is a risk factor itself in terms of having a heart attack and dying from heart diseases. So maybe about 15 years ago, they categorized people into 4 groups. Those with normal, marginally high cholesterol, and those with high inflammation, and those with none of the above. So of course, those with high cholesterol, not very high, just marginally high cholesterol and high inflammation, those were at the highest risk of getting heart attack and dying from the heart diseases. But those with low or normal cholesterol level with high inflammation, or those with high cholesterol with normal inflammation, that means the other 2 groups, has an intermediate risk. And the lowest risk was those without inflammation and without high cholesterol. So the 4 groups become 3 groups. So inflammation of the heart has been known to be a risk factor for succumbing to heart attacks. So there's low-grade inflammation that we talk about. Then the COVID-19 is another form of inflammation which affects the heart muscle following the vaccination. There is no specific treatment for that kind of inflammation, but myocarditis, myocardium. Myo means heart, myo means muscle, cardio means heart. So heart muscle, itis means inflammation. So inflammation of the heart muscle, certain types of specific inflammation of the heart muscle, there are medicines and they can be infused to reduce inflammation of the heart muscle and prevent the consequences of inflammation of the heart muscle. Most of the time, the heart muscle inflammation resolve by themselves with some form of medicine or with some anti-inflammatory agents. Rarely, the inflammation doesn't heal completely, and then they can give rise to abnormal heart rhythm, and that's when the person dies from myocarditis. Sometimes the heart muscle is injured, but it doesn't recover the function, and therefore it leads to heart failure. So yes, it can recover, but it can also lead to adverse consequences.
All right, next question from Ming Cheong. I had my mitral valve repaired 4 years ago. Do I need another surgery in the future to do another repair?
Yes, I think your doctor would have advised you very well on what happens after a valve repair. The best valve you have is always your own valve, and a repair valve is better than an artificial valve. But nonetheless, the valve damage has been done and it has been repaired, so that's good. But as with any other valve, it can deteriorate again, and so you need to be monitored closely by your doctor and see whether you require another procedure later in your life.
Now, another question coming from Gek Lun. I am currently on Warfarin. Can I take omega supplement?
For those who do not know what is warfarin, warfarin is a medicine which is taken to thin your blood. Actually, warfarin is rat poison. You go to the supermarket or go to the I don't know, hardware store, you ask for rat poison, that's what you get, warfarin. So they eat this, and then after they go back to the nest, they share the food, and then all the rats die because of warfarin poisoning, which is they bleed to death. So warfarin is it's a medicine that thins the blood for a variety of reasons why the person needs it, and it is closely monitored by blood tests. So we need to monitor the blood of the person carefully, because there's a lot of food and a lot of medicine that can affect warfarin. Basically, warfarin acts by blocking the activity of a vitamin known as vitamin K. Vitamin K is needed to form clotting factors. So by blocking the action of vitamin K, you do not have clotting factors, therefore the blood is less likely to clot. So medicine, food that have high vitamin K, for example, green vegetables and all those things, will affect the clotting, the efficacy or the effectiveness of warfarin. There are also medicine also can affect the effectiveness of warfarin, such as Panadol. You know, when you take Panadol together with warfarin, it increases the activity of warfarin and make your blood thinner and more likely to bleed. Omega-3 fatty acid usually come from fishes, the deep fishes. It can also come from krill. It can also come from elsewhere. But it is also a mild blood thinner. So it can also thin out your blood. So you're already taking a blood thinner, and you're taking another potentially another blood thinner, which can make your blood thinner. That may increase the risk of bleeding. So maybe when you are doing something like that, you should when you start doing something like that, you should monitor the counts and make sure that it is okay, your blood is not too thin, and then you may have increased bruises or nose bleeding, or when you brush your teeth, there may be gum bleeding, and some of these symptoms that you may see when there's too much warfarin.
Wow, there you go. Very, very complicated answer for a complicated question as well. So I'm sure, I hope Gatelun, you look into this a bit more and experiment a little bit, find out which one suits you best.
Yeah, better do it together with your advice from your doctor, because he needs to know. Sometimes things do happen, and then suddenly, because a person can bleed to death when we start vomiting blood or bleed in the brain, worse still, and that can be potentially fatal.
Okay, there you go. So for serious questions, for serious problems, you can always visit your personal doctor and find out a bit more. Now, let's go into prevention category right now. Now that we haven't heard, or whether we have learned more about the risk of CVD, its diagnosis, and a little about its treatment. Now, Dr. Mak, how can we prevent or reduce our risk of CVD?
Yes, I think our friend, our first questioner, Anne, has shown us the example. She says that she eats healthily and exercise 150 minutes a week, and she eats healthily. So precisely, I mean, she has given us the first statement of the questioner has already told us what to do. it is easy to say, but hard to achieve. That's what we all face. I know this is a struggle that everyone faces, that we need to eat healthily, live healthily, and then we should spend our rest well and rest healthily too. So we need to have a healthy diet. And then for particular those with special medical conditions like diabetes, high blood pressure, there are certain restrictions to the diet that you'll be aware of. So in general, a plant-based diet will be a better diet for most people. And also to obtain a diet, there's this, the Heart Foundation and the Health Promotion Board and the American Heart Association had this healthy plate suggestion of a quarter of protein, a quarter of whole grain, and some fruits and vegetables. So the consumption of processed food and food that you just buy off the shelf, they're usually higher in salt content. And these are the many hidden salts that we face. When we talk to the patients, we do not really, you ask them, no, I do not really add salt in my diet. No, even not like Amos or Westerners, whereby they sprinkle salt in the food and so on. But Asians do not do that at all. But we do dip our food into soy sauce, and that's where the salt is. And then we also like our sauces, our oyster sauce, our whatever sauce, ABC sauce, and all those other sauces. That's where all the hidden salts come from. So we have to be aware of some of these sources of salt that is increased in our diet.
True. We just had a last session where we talk about sodium, how much sodium and the difference between sodium and salt. So for those of you who want to find out more, look into our past program, not very far, about a week back, just a few days ago, in fact, more about sodium. Very true, Dr. Mak. Now, more questions coming in. This is from Sot Chen Doris. Now she asks, does my snoring issues affects my heart, snoring and heart?
Snoring it affects your partner. I see a laughter there. Well, yes, snoring affects your partner more than snoring is issue may or may not affect heart, depends on whether there is a condition known as sleep apnea. I'm not sure whether we are familiar with this condition known as sleep apnea, but sleep apnea is getting increasingly more diagnosed. It's a condition whereby the person actually, the airway is blocked during sleep. Because when we are asleep, the airway, the muscle tone of the back of the mouth, called the soft palate, becomes weak, and sometimes it closes. And when it closes, it blocks the air from flowing. Because it blocks the air and flowing, sometimes you may get a snoring noise, or it may come from the throat, although it can come from the nose itself. So that is called sleep apnea, or more precisely, one type of sleep apnea known as obstructive, because it's blocking obstructive sleep apnea. Apnea means stop breathing. So because the air doesn't really flow into the lungs, and you do not get air going to the lung, and associated with a variety of heart diseases, including heart attacks, sudden death, atrial fibrillation, which our earlier questioner has alluded to. It can also be associated with maybe diabetes as well. So there are many conditions that are associated with sleep apnea and heart diseases. Now, the question is not on sleep apnea, but on snoring. So snoring, not all snorers have sleep apnea because it just comes from the nose, but snoring is commonly associated with sleep apnea. So that's the condition that you want to make sure that you do not have, not just disturbing to your partner, but also disturbing to your own heart health and other health as well. So there's something that you can check with your doctor, whether you have obstructive sleep apnea, which is of more important concern than just snoring by itself.
Okay, next question from Francis O. I have high blood pressure and heart murmur. Any associations between these two conditions?
This heart murmur and first we have to find out because we talked about high blood pressure before. It's a very complex metabolic disease. we just take the measurement of the blood pressure, which Anne has asked earlier. And now we talk about a heart murmur. We talk about people murmuring about everything else. Heart murmur means that there's an extra sound in the heart which can be heard from the stethoscope when the doctor put the stethoscope on the chest. So a heart murmur is instead of dub 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 dub, you heard like something like dub sh dub sh dub dub sh. So there's a sh extra sound there. There's a heart murmur. Not all heart murmurs are bad. Sometimes just it's what we call a flow murmur. To understand that, you walk in the river, and if the river is moving very slowly or the stream is moving very slowly, you don't hear anything. But when the stream is moving very fast, for example, there's rapids and so on, so you can hear the water. So there's become a murmur. So similarly, when there's turbulence in flow, that's where the sound comes. So like, for example, people who are pregnant, they can have heart murmur because their blood flow increases. So therefore, they can have what we call this flow murmur. Sometimes a person who is very excited, the murmur can come along. So heart murmur can be abnormal or can be just due to some other what we call abnormal physiological states like pregnancy or something like that can cause heart murmur. So very rarely, there's a condition known as coarctation of the aorta. That means the aorta is narrowed, and that can cause the blood pressure to go up. The effect is something which is born with, and that can cause high blood pressure. So that's a very rare condition. Directly itself, heart murmur and high blood pressure, yes, heart murmur increases the damage to the heart valves, like what we talk about aortic sclerosis, aortic stenosis. So the damage to the valve can lead to aortic stenosis, and aortic stenosis can cause a heart murmur. So, but the aortic stenosis does not cause high blood pressure.
Well, we hope that answers your question, Francis. Now, next question is from Tan SH. How different is a CT angiography from an invasive angiogram?
Okay. Oh, we are getting very serious question, Samson. Okay. Angiography means angio means blood vessel, graphy means picture graph. So angiography means to look at the blood vessels. So in order to look at the blood vessel, we need to inject in a contrast to see. CT scan means that it is you go into a tunnel, and then the X-ray is shone all over you in a 360 degrees. And then they would look at a vessel where the contrast is injected in. Contrast is fill up the blood vessel, because then when the X-ray shines through, then you can see that the blood vessel opacify like a tube like that. So similarly, invasive angiography is different in the way in which a tube now is inserted into the opening of the blood vessel, and the contrast is injected directly into the blood vessel itself. So that's why it's invasive, because it invades into your body. So that's the difference between invasive and a CT angiogram. So the CT angiogram, because you are looking from afar, so they are what we call we are not able to see things as clearly as invasive. Just a simple thing like, when you get older, if I put the two lines and you cannot see the two lines together apart from a piece of paper. So whereas when you put the tube in, it is magnified. So there's the difference between one and the other. So they give you more, the resolution, how fine you can see is better with the invasive angiogram. The second thing is the CT angiogram is prone to some form of artifacts. That means, for example, if you do not hold your breath enough because the heart is moving, and if your chest is moving, then the whole pictures get distorted. It's like you take a photograph and you move and everything becomes blur. Yes, everything becomes blur. So the CT angiogram also has problem because when there's calcium is like taking a mirror there. So when you shine the X-ray, the calcium will reflect the X-ray. So when the calcium reflects the X-ray, you see the glare and you cannot really see clearly the vessel. So these are some of the limitations of the CT angiogram. Nonetheless, CT angiogram is about 90-95% accurate. In sometimes even 99%, depending on the age. For example, a young man like Samson will be 99%. So old man like me maybe less. So you'll be it'll be accurate if there's no calcium. The person can hold the breath like Samson, who is a tennis player, and he holds his breath for a long time, and the heart rate is slow, so his heart rate is about 50 beats per minute, then it's very accurate. But the invasive angiogram do not have this defect, but the problem is it's invasive. There are also problem with bleeding, puncture, and other heart attack risks related to the invasive. So the risk of invasive angiogram is higher, maybe 1 in 1,000 compared maybe to the non-invasive, maybe 1 in 10,000. So there are certain pros and cons depending on the need of which is needed for the individual.
Very good explanation there. Okay, last two questions. This is coming from Chong K. Lin. Now, my father has quite a low heart rate, most of the time below 50. Is it a health concern? And he has done ECG and the doctor said it's okay, but he's quite concerned with this low heart rate. What's your suggestion, advice?
I mean, your doctor has made some assessment, so I think it's good. He probably knows what he's doing. There are many causes of low heart rate. As I mentioned, no, Samson's heart rate is probably 50 because he's physically fit and an active sports person. So an active person has a low heart rate because then he has more capacity to increase the heart rate when he do exercise. That's why they play better than us, tennis, they run faster than us, they perform much faster than us because they have a low baseline heart rate. And when they go to 100 and say 180, it takes a long time for them to go. But if you start the heart rate at 100, very fast, your heart rate goes to 150, 180, then you become tired. So a low heart rate can be good, but a low heart rate, if it's too low to meet the body's needs, okay, that is when it's too low. You know, Samson can be 50 beats per minute, but he's able to meet his needs. He's able to function. He's able to dance. He's able to play tennis. Very good. But if the heart rate is low and it's not able to respond to, say, exercise, to stress, then it's the problem. So how do we know he doesn't able to respond? He's tired all the time. He's giddy, he's breathless, he walks. These are the symptoms that he's not able to meet the demands of his body. Then maybe there may be some room. There are other causes of low heartbeat. For example, low thyroid, they have low voice, and they're very fat. And so these are some conditions that have low heart rate and needs to be treated, and then the heart rate will become normal. So your doctor will probably done most of this assessment for your father and then see how he is.
Okay, folks, we're down to our final question. We hope the viewers have enjoyed this wonderful session. Now, last question is from Fu Ming Yo. Which reading is more accurate, the wrist or arm blood pressure monitor?
Well, the wrist pressure monitor would say that the wrist monitors are fairly accurate, but a lot is prone to artifacts. In experimental conditions, probably they are able to do it very well, and the person is able to comply with all the instructions, and the readings are accurate. But in the so-called in the world in general, the real world situation, I think the arm cuff is probably more accurate. The only problem is when they inflate, they got the sound and the pump, the pressing, and it can cause the pain, and that can raise the blood pressure, as we talked to it about earlier. So that is the other deficiency of the palm and the wrist blood pressure monitor. So most of us would probably like to use a palm, although there's more and more people trying to use a wrist blood pressure monitor as a form of monitoring. Of course, both devices have been tested in order to be used in Singapore to show that it is accurate. But in terms of operator dependence and the way it is done, sometimes we have to see which one the person can be fair. So the best thing is you can try it and test it with your pharmacies, with the doctors, and see which one is suitable for you.
Or not try both as well. Have one at home and have one at everything. Well, you can't bring the whole machine out as well, right? That makes sense. So it's good to have both. I have one at home, but I haven't got the wrist one. So for those who have the wrist one, it's good. If you don't have the palm at home as well. Two is always better than 1. You get better readings. Okay, now, Dr. Mak, before we end our program, would you like to share some final closing remarks or tips or advice?
Yes, I'd like to thank Heart Foundation, Samson, and all the listeners and all of you for your wonderful questions. I hope you live healthily, continue to have a healthy lifestyle, eat well, and stay safe in this COVID season. We know that though it is very tough on everybody, keep sane. That's the most important. Sleep well and have a good rest. Thank you.
Well, thank you, Dr. Mak, and all our viewers also for joining us today. We hope you have learned a lot about your heart health and take the first step to reduce your risk. Now, for more information on heart health, you may visit the National Heart Week / World Heart Day 2021 virtual event at myheart.org.sg / World Heart Day. So don't forget, folks, we're going to share the link into the chat group. So we hope you guys will click on it and, of course, find out more. So with that, ladies and gentlemen, we want to thank Dr. Mak once again and all the crew working at the SHF behind the scenes, and also to you as well for being our regular and, of course, our loyal fan as well to find out more about heart health and how you can improve yourself as well. This is Samson Z saying goodbye. Thank you, ladies and gentlemen, and please stay safe. Goodbye.
Bye-bye.